YouTube video and another news review. Guys, before wasting any time, let's go straight to the video, and this is: don't bet on vaccine to protect us from COVID-19, says World Health expert. Professor of Global Health at Imperial College, London, warned we may have to adapt to coronavirus. So, like I said in my previous videos, is exactly what I sort of reviewed the situation with the vaccine. Well, he's further down, he says humanity will have to live with the threat of coronavirus for the foreseeable future and adapt accordingly, because there is no guarantee that a vaccine can be successfully developed, one of the world's leading experts on the disease has warned. The start message was delivered by David Nabarro, Professor of Global Health in Imperial College London and an envoy from the World Health Organization on COVID-19, as the number of UK hospital deaths from the virus passed 15,000. A further 888 people, like I mentioned, that it was on Saturday. So the latest figures which do not conclude deaths in the care homes and in the community put further pressure on the government amid continuing anger among NHS workers and unions over the lack of personal protective equipment for the hospital and care home staff on the front line. Same issues over and over again. I did a very detailed video yesterday or day before on the vaccine. Like I said, there are news coming from everywhere that we are very close to get a vaccine. There was a UK scientist, she sort of said that she's working hard and she will get a vaccine. There was something else also mentioned in regards to the vaccine, that we should get the vaccine by the end of August. But this is not the truth, guys. I've given you my very detailed opinion on this, and it was backed by the Bill Gates interview recently on the BBC, where he clearly said, look, the minimum time we need to get the vaccine for this coronavirus COVID-19 is 18 months. Before we go through all the trials, before we get everything sorted, before we get through all the stages that are required to carry out the full test of the vaccine. And then after that, we can take it to the approval of the government, and then we can ask distribution and pharmaceutical companies, and they can start producing the vaccine, and then it'll be available for general public to take it as just to create a prevention. Well, it's very clearly said. I don't know why we're going round and round in this now. This vaccine, it clearly says don't bet on it, because there's no guarantee of success. It's just pure trial. Let's hope that this vaccine works and we start to get to see better results in terms of virus. And the second thing I would like to mention about this virus is that it's keep changing. So we're not 100% sure that the vaccine we're gonna create, or the scientists are going to create. Don't forget that this vaccine, they are going to make, United Kingdom, in UK, they're going to make 1 million doses of this vaccine, and this will be tried on NHS workers, frontline staff, key workers, and also some army personnel and police officers. So the whole experiment will take place on our key workers, frontline NHS workers, and all these people, and from there on we'll get to see, and also in the prison services as well. So I believe that it's gonna take quite a big experiment just to see that if we can get this vaccine going and it give us any good results. But like I said in my video, it's difficult, because at the moment, the first thing first, we need to get the testing in place. The testing is very important. Without the testing, there's no point, because we need to know that what people had the virus, how quickly they recovered, if they had the virus, they didn't have the virus, what were the symptoms, people who recovered from the virus, what was the reason behind that. I did a video about the plasma transmission, which is simply taking the blood cells of a person who had coronavirus and he recovered, and injecting those plasma into the person who's struggling to recover from coronavirus. So the very simple process, and it gives us a very good idea. In one way, we can use that as a vaccine, because we need to save lives at the moment. The time frame of getting the vaccine, like I said, is a year to 18 months, which is on a very fast, rapid pace if we get that vaccine. Before that, this is the best thing we can try. Every other country has tried. Germany has tried. We're looking at China, they tried that. This is how they kept the numbers very low in terms of death toll. And South Korea, they tried exactly the same thing. Because at the moment, something is better than nothing. What we can try, what is available, let's do that. And then wait for the vaccine to come through, and let's go through the proper processes before we risk people's life by trying this vaccine. So this is my whole take, and I've done quite a few videos on this topic of saying that this is just a trial. Let's hope, and the people are going to be be part of this trial. Let's hope that it works on them. But before we get the numbers of tests, before we try this vaccine, is very, very important, guys. So thank you very much for watching my video, and this is the first time you are watching my video, please don't forget to subscribe to my channel, and also click the bell notification button so you can get the future coming notifications straight into your YouTube account. If you want to add something, you want to share your experience, please feel free to do in the comment section below. I'll see you in the next video. Thank you very much. Bye bye.